thyroid is really important to look at. Those like little sluggish thyroid that we were talking about earlier has a huge impact on pregnancy. Most well-versed, reproductive endocrinologists will even acknowledge that there's a pretty tight window within that normal TSH where you want your TSH to be if you're trying to conceive. So that's definitely something to test. You also mentioned progesterone, right? So if you have low progesterone, you can have those shorter cycles. That second half of the cycle, which we'll talk about a little bit more in a little bit, is, that's what's kind of giving the egg the chance to like implant, and sort of giving it time to do that. Sometimes, if there's not enough progesterone, that can get in the way as well. So looking at progesterone, particularly if a woman has a shorter cycle, like 24, 25, 26 days, looking at progesterone can be really helpful. And then, yeah, I mean, I love when people come in and they're being proactive about like, hey, I want to get pregnant in 6 months or 12 months, because once you want to get pregnant, it's like everybody wants to be pregnant yesterday. So then it's a little harder to get the foundations going. But yes, sometimes looking at an AMH makes sense. It is a pricier lab, but it kind of gives a general overview of like egg quality is sort of what it reflects essentially. Also looking at estrogen in the beginning of the cycle. So usually days three through 5, we'll look at an estrogen, an LH, and an FSH. So LH and FSH are kind of like that TSH in that diagram we had, where they come down from the brain and they go to the ovaries, and they're sort of saying like, hey, make estrogen. And so if they're elevated, right, that means for whatever reason, the ovaries aren't responding to that signal. So you don't want them to be elevated in your kind of prime fertility years. So looking at those can give us a really good kind of starting place.